So commonly we hear physicians quoting a specific multiple that their friends sold their practice or surgery center for. And I think it's really important to understand that all assets are different on the operational side. And so it's very important to listen to your advisor, listen to your attorney, listen to your CPA, to understand the nuances of your transaction and properly manage your expectations in terms of what the value could be, because not all assets are created equally.
I think that businesses, physicians, sellers are thinking that their structure of their operations and real estate will continue the same post a transaction as it were before. However, things change, people move on, physicians retire, relationships change, and therefore it's critical to make sure the longevity, particularly from a real estate perspective, is set up for success from the lease structuring. Everyone knows their position from a landlord and a tenant perspective, so that there's a smooth transition, and going forward everything is set out very clear, because past operations and the way that the business and particularly the real estate has been operated prior to the transaction will not be the case, and therefore it's important to get that set up correctly.
One thing people are getting wrong about the healthcare M&A market, and also right too, is the volatility of it. There's increased volatility within the market, but there's the reason why that's wrong is there's always been volatility. Is when the government sets the rates, people are beholden to them and the rate cuts. And so unfortunately, we're going through a time of reform, and that volatility will be here, but it's always been here. And so the healthcare marketplace is a stable place, and the government's a good payer. So people ultimately will have to just relax and live with it.
I have 2 or 3 comments on that. The first is, everyone hears private equity. Not everyone. A lot of the public and doctors and other providers hear private equity, and they have this knee-jerk reaction, like bad. And there has been some bad press with some hospital bankruptcies, like Prospect and Steward, and private equity in hospitals posing potential issues to patient access, and closures of hospitals and sucking money out and all that kind of stuff. But there's a lot of good operators in the private equity field in hospitals, but even more so in everything else healthcare, like physician practices, home health companies, ASCs, imaging, I can go on and on, behavioral health. The private equity investors are doing really good, are helping companies do better, physicians do better, compensation better, by really investing in the business, in additional offices, additional providers, additional or new ancillary services like ASCs, and that is really helping providers in the long run. So there's a lot of positive. Not every private equity investor is awesome. I would say, in my experience, 80 to 90% are good, and the sellers, the operators are happy with their deals, but there's always bad apples out there. So do your diligence, do your reverse diligence on the private equity investors and their other investments and platforms, and how happy or unhappy sellers are with their private equity transactions and partnerships. And then third, I would say that everyone thinks, when they think of private equity, they think, oh, it's just, private equity owns it, and it's bad because all they want is get profits. The truth is that private equity just makes an investment in a company they believe in. And then they invest more in the company going forward. What they're building are companies. And there's lots of other companies out there that have investors. So it should just be viewed as a company that has an investor behind it for expansion and growth, just like any other company. And the good ones do very well at that.
It was several years ago. I think buyers are becoming much more receptive to not just doing transactions for scale, just for the sake of scale. They are being more discriminating about what they're looking for in terms of a service line or perhaps a geographic expansion. and just looking at things much more critically, as opposed to feeling like we need to be in a market and we need to have a certain level of scale, and not necessarily thinking through all the assets that you're putting together and how are they going to integrate, what is that operation going to look like when you basically put all these things together. Did you end up getting what you expected to get, and you're going to be able to manage it in the future based upon that.
So I think the thing that folks are getting wrong in the market right now is alignment. Alignment of how we're thinking about compensation and the go-forward path for most organizations when they transition to private equity, when they're bringing in a new partner, when they're doing a JV, is how do you create alignment that what you're getting compensated on and rewarded on help not just the individual, but the organization as a whole. And we spend a lot of time talking about how to drive alignment across ownership and across organizations, so it's driving what the individual but what the organization needs as well, and that's a big area that's getting missed.